My name's Jennifer. I'm a local community health nurse. I was asked to come here today to talk to you guys a little bit about HIV. HIV is the virus that causes AIDS. It is also known as human immunodeficiency virus. One of the first questions that I'm asked is, what is HIV? And simply put, HIV is a virus that is transmitted from person to person through blood. Eventually, HIV will take over a person's immune system, and that's what kills you. That's what makes you sick, is you get pneumonia and you can't fight it off as well as a person that's HIV negative because your immune system is so compromised. Eventually, HIV will turn into AIDS, which is acquired immune deficiency syndrome. One of the first things that people also ask me is, how do I get it? How is AIDS contracted? And there's three main categories there. That is the common ways that you can get AIDS, the less common ways that you can get HIV, and the third is the ways that you can get it, but maybe they're just not as plausible. The main two, unprotected sex, sharing needles with an HIV infected person. The lesser common ways, but still you can get it like this, is mother to child during birth or breastfeeding. Getting stuck with an HIV positive needle. Some of the lesser common ways of contracting AIDS are through oral sex, through blood transfusions, because blood's screened highly before it is ever sent to the blood banks. That's a common practice now. It wasn't so much back in the 80s when the AIDS epidemic was going on. So people always still worry about that, especially the older generation, because that's what they knew. But that's not something that happens so much anymore. You're generally not going to get it from open mouth kissing. Can you? Sure. Is it likely? Not so much. So what does HIV turn into? What is the etiology and pathophysiology of AIDS? At the beginning of the epidemic, HIV and AIDS affected men that had sex with men. It was known as the gay disease. That's not always the case. A person that shares needles when using IV drugs, people who receive large volume blood transfusions or blood products, heterosexual partners of HIV infected persons, and children of infected mothers. Currently, the majority of infections are found in men who have sex with men, and disproportionately among racial minorities, IV drug users, and we're seeing a lot of the transgender community now that it's coming up with the HIV positive status. It's very important to disclose that status to your sexual partners just to help with the transmission of AIDS. How does HIV get in the body? HIV enters the body through unprotected sex or blood-to-blood transmission. After transmission, it targets immune cells that carry CD4 positive receptors, specifically T cells and macrophages. After invasion, HIV uses the cell components as a place to reproduce. They get in there and they reproduce, and the reproduction of HIV within the host cell ruptures the cell membrane, which relaxes and releases more HIV virions into the plasma, which in turn bind to and disable the other CD4 positive cells, causing the immunosuppression. How do you know if you have AIDS? How do you know if you have HIV? How can you find this out? There's three major ways. Number one is the enzyme-linked immunosorbent assay, which is the ELISA test. It's a serologic test used for detecting antibodies to HIV. After you have a positive result for that, you're going to receive the Western blot test, which is a confirmational test that follows up with ELISA. There's also the rapid test. Generally, the rapid test is used in a setting when you think that maybe your patient, if you work in the healthcare field, maybe you think your patient's not going to return. Maybe they're homeless. Maybe they're embarrassed. Maybe they're young and they don't want to tell. Maybe they're cheating on their partner and they don't want their partner to know. So you have to worry about whether they're going to come back. You see a lot of this in the ER. You see a lot of this in urgent care clinics. There's vans that travel around, even some STD clinics. You can see it there. You get those results in about 15 to 45 minutes. There's also the antibody test. The antibodies to HIV generally take 2 to 12 weeks to develop. Therefore, a negative antibody test, it may catch a person within the first 12 weeks time. That's known as the seroconversion time, which is also known as the window period. So you have to be really careful during that period. Some clinical manifestations that you're going to see with HIV positive status. On your pulmonary department, you're going to see a persistent or acute cough. Sometimes that's going to have a sputum production with it. Sometimes it's not. Your GI symptoms, you're going to have diarrhea. You're going to have weight loss. You have anorexia. You're going to have abdominal cramping. a feeling of fullness, like you're bloated all the time, and some rectal urgency. Oral manifestations, you'll see lesions in your mouth. They're usually white plaques on your oral mucosa. You're going to see white thickened lesions on the lateral margins of the tongue, like the outside portion of your tongue. And these are caused from hairy leukopenia. You might see some oral warts in your mouth from the HPV virus, and you could have some periodontitis. Central nervous system, some manifestation that you're going to see are cognitive, motor, and behavioral symptoms that possibly could be caused by AIDS-related dementia. Maybe your mom or dad, maybe your cousin, aunt, uncle, husband, sister, wife, mother. Maybe they're not just acting as normal as they should. They seem like maybe they have some dementia, but are they at the age for dementia? It could possibly be AIDS-related dementia. Acute infections, a big thing. You see a lot of acute symptoms going on. The acute symptoms that you need to look out for are fever, malaise, which is a general feeling of not feeling well, like you just don't feel good. You can't put your finger on it, but you just don't feel well. You could have a headache. You could have a change in mental status, like I was talking about earlier. You could have seizures, hemiparesis, which is no movement on one side of your body. One side will move, the other side doesn't. You can see abnormal gait, which is walking, and it's not the normal pattern. You're kind of pitching, falling side to side. You could have abnormal speech, where you have a little bit of slurring. Maybe your words don't make sense. Maybe it's a little bit of word vomit. You can also see cryptococcal meningitis. As far as malignancies that go along with HIV, you have AIDS-defining cancers and you have non-AIDS-defining cancers. AIDS-defining cancers are Kaposi sarcoma, non-Hodgkin's lymphoma, and cervical cancer. Non-AIDS-defining cancer, you have liver cancer, lung cancer, and anal cancer. So treatments for HIV, they're much more advanced today than they were when the AIDS epidemic was initially going on. The number one is the antiretroviral treatment. There's a 4-part purpose for this treatment. Number one is to decrease the viral burden, which increases your immune function. So that's going to keep you healthier. Number two is to prevent morbidity. Nobody wants to die. You don't want to get this and die, so you're going to do this antiretroviral treatment. It's going to cut down on your chance of morbidity. You want to increase your quality of life and also your chance of survival. That's number 3. And number 4 is to prevent HIV transmission. If you have this virus, you do not want to transmit it to somebody else. Again, while you should always be open with your status, with your sexual partners. The thing with this is you have to be ready to do it. You have to have strict medication adherence, which equates to about 90% medication adherence. You have to be ready to take your medicine. So if you're a healthcare professional and you have a patient that's newly diagnosed as HIV positive, you need to make sure they're ready. You need to know that they are ready to take their medicine, because if not, it's not going to work for them. So they have to be in that mindset that they're ready and they can commit to this for the rest of their life. Some co-specialties that you should see, if you would have HIV, quickly to go through these: an infectious disease doctor, a nephrologist, a pulmonologist, cardiologist, gastroenterologist, neurologist, OB, if you're a pregnant female or, a female that intends to be pregnant in the future, dentistry, surgery, psychiatry. That's a big one because mental health is overlooked when this disease is talked about. Nursing, because nurses are going to be the ones that are providing you a lot of education. You need to see a nutritionist because you're gonna become anorexic. You're not gonna feel like eating. You're not gonna want to have the nutrition that you should. So it's very important to see a nutritionist, and also a social worker, because a social worker can help you out with the things in life that maybe you can't get your hands on. Durable medical equipment, referrals to PT, OT, ST. Whatever you need. You need to have a social worker in your corner. That's always going to help out. So quickly, if there's anybody in the back that has any questions, I would love to hear them. We can see what we can find out. So, what was your question? I'm sorry. Oh, you're a nurse. Okay, so I have a patient that said, an attendee that says that she's a nurse, and she wants to know what the chances are of her catching HIV from a needle stick. Honey, that is about 0.3%. Very unlikely, but should that happen, the first thing that you need to do is go report that to your charge nurse. Can you get a positive result from a pap smear? So can you be diagnosed by AIDS or HIV with a pap smear? Okay, no, you can't. Pap smears are generally used for detection of cervical cancer. For AIDS or HIV, you need to have a saliva or a blood test done. Okay, and what was your question? Okay, what activities can I do that are gonna increase my risk for HIV transmission? Okay, so number one is receptive anal sex, 1 in 72 chance with that. Then you have IV drug use, 1 in 159% chance of that. Insertive anal sex, you're going to have a 1 in 909% chance of that. Receptive penis to vagina sex, 1 in 1,250. And also, same thing with insertive penis to vagina, it's going to be 1,250. So if you guys have any questions, don't hesitate to stop by the health department. Ask for me. My name is Jennifer. Any of my coworkers, we would be happy to help you out. We can help you with distribution of condoms, how to use condoms, some birth control. There's some pamphlets by the door that you can grab on your way out. And if you have any questions at all, please let me know. And thank you for your time.